Vaginal discharge is a normal part of everyday life for every woman, and it comes in different colors. The color, amount, consistency of vaginal discharge can change from day to day depending on where you are in your menstrual cycle, whether you are about to menstruate or just finished menstruating, or pregnant or ovulating or sexually aroused or even infected. But what do you do when your vaginal discharge has a different color from your usual discharge and you wonder if it's still normal or it's something that needs to be checked out? In this video, we shall be talking about the different colors of vaginal discharge and what they mean. Are they normal, or is there an underlying disease that needs to be investigated? Should you manage at home? When do you go to see your doctor? Hi ladies, I'm Dr. Jides, your community physician and public health specialist. Welcome to my channel where we discuss women's health and lifestyle. Today we will be discussing the different colors of vaginal discharge and what they mean. So what is vaginal discharge? The vagina is a mucous membrane, just like the mouth, and the cells of all mucous membranes tend to create liquids or fluids. And the vaginal discharge is the fluid secreted by the tiny cells of the vagina and the cervix. And this is part of what is keeping the vagina normal and healthy. This fluid leaks from the vagina every day to remove old cells and debris and unwanted materials, and that is how the vagina keeps itself clean and healthy. Vaginal discharge can come in many colors, and the different colors may mean different things. And the first vaginal discharge color I'd like to talk about today is clear. Most of us are familiar with this color, and this is your normal vaginal discharge, and it usually has no smell. It may have a slightly acidic smell, and it varies in amount or consistency depending on where you are in your monthly cycle. So you may notice that the amount is less, much less after your period, and it increases when you are ovulating or during pregnancy or breastfeeding or sexually aroused. Its consistency also changes, so you may notice it's clear and watery, and this can be at any time, but especially after a heavy exercise. And it can be clear and stretchy and mucus-like, and this occurs a few days before ovulation or during sexual arousal or during pregnancy, just like this consistency of the white egg. Just like this. And after your ovulation, this vaginal discharge goes back to being sticky or tacky or cloudy, and may appear white or off-white or creamy or yellowish in color, slightly yellowish in color. And all of these that you see on the screen right now are completely normal vaginal discharge and doesn't need any treatment, especially if it's not associated with itching, burning, or irritation of the vulva. The next discharge I would like to talk about is cream or white vaginal discharge. This color of vaginal discharge ranges from cream to light yellow. If you have no other symptoms such as itching, burning, stinging, or having an offensive odor, then the cream or white vaginal discharge is most likely a sign of healthy lubrication, and so it's normal. However, if the discharge has the consistency of cottage cheese, white, thick, and odorless, or sometimes has a strong smell, then this is most likely going to be a yeast. Yeast infection is also known as thrush and is most commonly caused by a fungus called Candida albicans, so it's also known as vaginal candidiasis. Vaginal yeast infection affects up to 3 out of every 4 women at some point in their lives. And it's not as if the yeast comes from outside to infect the vagina. No, the yeast normally lives in the vagina. That it is normal habitat. But then there are some certain good bacteria. I like to call them good bacteria because they cause no harm. And they live in the vagina and they act to prevent the overgrowth of these yeasts. But when you have a situation where there is an imbalance or the balance of these good bacteria is distorted and these bacteria are killed off, for example, when you're pregnant or when you take a course of antibiotics or corticosteroids, oral contraceptives, hormone therapy, or if you have any condition that kind of lowers your immunity like HIV, AIDS, uncontrolled diabetes, All of these things cause an imbalance in the natural vaginal flora, and when that happens, the yeasts then start to multiply and they overgrow, and that's what gives that white, thick, cottage, cheese-like discharge. They're commonly present with intense itching and irritation in the vulva and vagina. There's burning sensation, especially during intercourse and or when urinating, and this can make sexual intercourse very, very unpleasant and undesirable. There could also be watery discharge from the vagina, redness and swelling of the lips of the vagina. This can make sitting down very discomforting. Yeast infection can be treated with antifungal medications for about 3 to 7 days. These medications come in form of creams, tablets, and pessaries. Now, take note of this and this so you don't mix them up. This goes into your mouth while this goes into your vagina. Some of these medications are available as over-the-counter medications, so you could actually go pick them up over the counter and treat yourself at home. Please see a doctor if your symptoms are not relieved after treating with over-the-counter antifungal vaginal creams and suppositories, or if you're not sure whether you have a yeast infection or you have some other symptoms associated with that. The next discharge I would like to talk about is the red or pink discharge. Anytime you see a red or pink tinge in your vaginal discharge, it simply tells you there is blood somewhere around. Red or pink discharge is mostly as a result of bleeding, and it is normal, especially if it's during or just after your period, or it can also be abnormal depending on the circumstances. Pink discharge commonly occurs before the start of your period. You know how it is. You go to the toilet and you wipe, you clean yourself, and you look at the tissue and you're like, oh yeah, she is coming, because you see that pinkish discharge there. And it's okay because your body is shedding the uterine lining. So if you have a red or pinkish discharge, it simply tells you there's blood around. Birds, don't be too quick to relax because it could be something else. It could be something else, really. If you've recently had an unprotected sex and you're not having this pink or reddish discharge close to the time you're about to see your period, it could be a warning sign, because that pink or reddish discharge that you think is about the start of your period could actually be what we call implantation bleed, and that means you could be pregnant. Every month your uterus prepares itself to receive a baby. So the uterus gets ready, and it does this by thickening its lining. Blood vessels are all plumped up. Then this fertilized egg comes and attaches itself into this plump lining, and this causes some kind of bleeding, which you may see as pink discharge, and you think, oh, my period is coming. No. You may need to do a pregnancy test so you can know whether you're pregnant or not. You could also experience a pink or reddish vaginal discharge towards the end of your period. You may notice the color of your discharge becomes dark brownish in color, like this. And this is because the flow of your menstrual blood has become slow, and the blood is hanging around in the vagina and getting oxidized, and that's what's giving that brown or dark red tinge to the vaginal discharge. This is nothing to worry about, and you don't need any treatment because it will usually clear up when your period has completely finished. Rarely, a dark brownish vaginal discharge may be a sign of cervical cancer, and this will be accompanied by other signs such as pelvic pain and pain during intercourse, vaginal bleeding, bleeding between periods and after intercourse. Another time where you can get a red or pink vaginal discharge is shortly after sex. That is when the sex has caused small tears or irritation as a result of friction. There's usually friction during sexual intercourse, and depending on how severe the friction is, it could actually bruise the vagina, or you could have minor cuts in the vagina which will bleed and then cause pink vaginal discharge. Some people also experience a little spotting during ovulation, which could present as pink discharge, and this is okay. Some women experience bleeding in between their periods. This is called intermenstrual bleeding or spotting, and it can start off with a red or pink discharge. So you're kind of expecting your period to come maybe in a few weeks, and you start having a red or pink discharge now that's looks like your period is about to come. This is called intermenstrual bleeding. Please see your doctor. If you experience any kind of bleeding in between your periods, it's mostly benign, but it can also be a sign of a more serious condition. Another warning sign is when you're already pregnant or you're in early pregnancy and you start noticing a blood-stained or pink vaginal discharge. This could be a sign of early miscarriage, and in this situation, you definitely need to seek medical attention urgently. If you've entered menopause and you haven't seen your period for about a year or thereabouts, and suddenly you start getting this pink or red vaginal discharge or even frank vaginal bleeding, this could be a warning sign of endometrial cancer. So please go and see your doctor so that you can get diagnosed as early as possible and commence treatment immediately if necessary. And this brings me to the end of the first part of this video. Please watch out for the part 2. In the second part of this video, I shall be discussing all the vaginal discharge colors such as green and yellow and gray. And I'll also be letting you know how to avoid abnormal vaginal discharge and when you need to ditch the self-care and take your vagina to the doctor. So don't miss that. If you found this video useful, please like, subscribe, and share it. And of course, comment below and I'll be happy to answer any questions you may have. And always remember, your health matters. Bye.